So we'll talk about Garbosa criteria. Garbosa criteria is basically used in left bundle branch block. In patients with left bundle branch block, what happens is that in left bundle branch block, you have you will see a M pattern in the V5, V6 and a W pattern in the V1 and V2. Wherever there are negative QRS is there, there will be discordant changes will occur. Discordant changes will be seen in the ST and T waves. So depolarization and repolarization, there will be discordant changes will be seen. So you may see a ST elevation here. This ST elevation is not significant. It is considered significant for which there is a criteria is given is called as Garbosa criteria. Garbosa criteria, it means concordant ST elevation of more than 1 mm. Suppose there is this is a what does concordant ST elevation means that wherever there is a positive QRS is there, if that wave normally what we have said in LBVP is that if there is positive QRS, there should be ST depression and T inversion should be there. But if you see ST elevation, ST segment elevation, if you see rather than ST depression in the concordant lead, and if that is more than 1 millimeter, it is called as a positive sign, and this signifies that it has a score 5. So that means that if this feature is there, it is suggestive of myocardial infarction. Second is concordant ST depression. If you see a concordant ST depression, that means if there is ST QRS is dominant here. You can see here the QRS is negative here, and so when it is negative, generally there should be ST elevation should be there. But if there is ST depression, if you see of more than 1 millimeter, if you see more than 1 millimeter ST depression in the concordant lead, then also it is considered to be significant. A score of 3 is given. What is excessively discordant ST elevation? So suppose normally, as you have said, that ST elevation will be there discordant. So if the QRS is negative, there will be ST elevation. If the QRS is positive, there will be ST depression. Excessively discordant ST elevation, that means that if it is more than 5 mm of elevation is there, if this ST elevation, that is J point is from baseline, if it is more than 5 millimeters, it is also called as a positive Garbosa criteria. This was the original criteria which was made, which was modified later on. Modification is only in one thing where there is discordant ST elevation where it is given as more than 5 millimeters. It was changed that if ST elevation here, if it is more than 25% to the height of this QRS, then it is called as more than 25% of the depth of this S wave. Then it is considered as a positive sign. You can see here, this is a ECG where you can see here there is a AVL, you have LVB morphology and positive R wave is there. But you can see also see, so normally in this lead you must have a negative, there should be ST depression and T wave inversion. But you have seeing here is ST elevation and T upward you are seeing. So this is characteristic of what is called as a positive Garbosa criteria.